Dr. Tedros, WHO's Director General, recently said that he wants to see a world safe from health threats. How do you see WHO's global influenza surveillance and response system shaping the global health agenda?
That's a great question. I think that WHO's global influenza surveillance and response system is GISRS, known as GISRS, is very important to helping shape the global health agenda because there's no greater threat in our lifetime than a pandemic of influenza. And the GISRS system is constantly monitoring the world for viruses and pandemic threats through conducting routine risk assessments. And they also play a vital role in helping countries prepare to tackle threats like pandemic influenza.
And how important would you say is influenza surveillance in contributing to improved preparedness and response against other emerging respiratory viruses at the country level?
Oh, this is one of my favorite questions. I think influenza is a poster child for capacity building. And so I think the capacity you build for influenza, whether it be laboratory, surveillance, risk communications, rapid response teams, and implementation of vaccine or pharmaceutical programs like antivirals, it helps you prepare for other emerging diseases because it's a practice. It's an everyday practice that goes on, and you gain skills through working with flu, which is present year-round in many places in the world, and every year certainly countries have to deal with influenza. And so we've found over and over that some of the capacity that's been built for influenza really has been used also to respond to things like other respiratory infections, MERS or SARS, and things like Ebola even for rapid response teams. So I think the capacities built for influenza are very important for capacity overall for emerging infectious diseases.